X's on the floor. Ready? All right. Well, good morning. I want to thank you all for being here for a very important update on Missouri's legal effort against the opioid manufacturers and distributors. I want to thank Patty and Ellis Fitzwalter, parents of Michael, who was a victim of opioids, Kathy Arbini, mother of Kevin, who lost his life to opioids, Craig Miner and Laura McAllister with Places for People, and Angela Clabon, CEO of CareSTL Health, for joining me here today. I'm honored to be in your presence, moved by your struggles, and grateful for the work that you do day in and day out to fight the horrific devastation that the plague of opioid addiction has unleashed on families and communities here in Missouri. After many years of intense hard work in litigation and wrangling with big pharma companies as they attempt to slow walk the process, the Missouri Attorney General's office and the attorneys general from across the country have reached settlements with some of the major players in the opioid epidemic. Specifically, Johnson & Johnson and other major opioid distributors, McKesson, Amerisource, Bergen, and Cardinal Health. We are still waiting for a final term sheet, but we're estimating that the settlement for Missouri will be slightly over $500 million. In addition, Purdue is proceeding through bankruptcy, and when that's resolved, Missouri's share will be slightly over $500 million. And let me be clear, that is if all counties and subdivisions sign on to the agreement. If the subdivisions and counties don't sign on, the funds Missouri receive will be approximately half that amount. So it's imperative for the counties and subdivisions to sign on to receive the maximum benefit for victims across the state. The size and nature of this agreement will result in the largest victim-centric settlement in the history of the state of Missouri, meaning every dollar will go to fighting addiction and funding treatment for real people, not just general revenue. Details on the agreement are still being worked out, and I'll get into some of the specifics in a few minutes. But I first want to say a few words about why the state of Missouri filed this lawsuit and why we fought so hard to bring it to a successful conclusion. Make no mistake about it, our lawsuit has always had a singular mission: attain justice for victims and the families of the victims of this decades-long opioid epidemic that has been unleashed on the people of Missouri by callous pharmaceutical companies whose greed and indifference wrecked the lives of thousands and thousands of our neighbors and loved ones. The loss of human life has been absolutely devastating. Too many have been cut tragically short. Bright futures have been shattered. Families have been ripped apart. Sons, daughters, mothers, fathers, aunts, uncles, brothers, sisters, friends, and loved ones have been torn from their loving arms of their families, leaving gaping holes in the hearts of those that they left here on this earth. No more birthdays, holidays, or milestones. No more just average, ordinary days. As a drug that was falsely marketed as a safe and non-addictive solution to pain, the actual pain it caused Missouri families is undeniable. And the opioid epidemic knows no boundaries by race, geography, gender, income level, or age. Tragically, this settlement will not bring back a single loved one who has died. No amount of money can repair the loss and pain felt by the families and loved ones. This settlement cannot change 1 minute of the course of the time that has passed. But what it can do is bring justice to the Missouri victims of the opioid epidemic and their families. It can provide funding we need in our state to help people who continue to struggle with opioids and other drug addictions and make sure they get the help that they need through treatment and mental health services. With the funds from this settlement, we can help protect future generations to avoid the destruction that's been wrought by this crisis through education, prevention, and intervention. Make no mistake about it, this crisis still rages on. In fact, in 2020, drug overdoses in our state increased by nearly 17%. That means that 1,842 people lost their lives last year. Let that sink in. 1,842 due to drug overdoses. And that means that 5 Missourians, human beings with families and loved ones, are dying every single day. Nationally, the number of people who die from opioids equates to essentially a plane going down every day of every week, of every month, of every year. And a vast majority of those overdoses are due to opioids. The problem is real, it is vast, and we need relief right now. As I mentioned, the details of the final settlement are still being worked out, but what I can tell you here today is this. Number one, after months and months of studying the proposals, Missouri is confident that this is the best deal we can achieve in a timely manner, and we intend to sign. Number two, the agreement will provide money in the amount of hundreds of millions of dollars, as I mentioned, slightly over $500 million, that Missouri and our communities can use almost immediately. Per a law passed in the legislature in 2020, every single dollar that the state of Missouri receives must be used for abatement of this crisis and must fund programs and grants administered by 4 agencies: the Missouri Department of Mental Health, the Department of Social Services, the Department of Public Safety, and the Department of Health and Senior Services. And no portion of the money that goes to the state of Missouri can be used for legal fees. And actually, we were one of the few states in the whole country that did not use outside counsel to litigate this case. And here's why. We knew that we had a talented and capable team right here in this office. Many of them are here, and we wanted the maximum amount of dollars to actually go to victims. In addition, Missouri has the opportunity to maximize those funds we receive, potentially adding tens of millions of dollars to the settlement. If we do so, if we come together as a state, and that means all of Missouri's subdivisions must join us in the settlement and drop any litigation that they have against the opioid manufacturers and distributors. Failing to do so will reduce the dollar amount that we receive in this settlement by almost half. And that would be a tragedy for our state and for the victims of this crisis. After all, we all want to get the money to the communities and people served by us as their public servants. On the other hand, achieving a universal sign-on to this agreement by all Missouri cities and counties will benefit the people will benefit everyone that we're all sworn to protect. So over the next few months, my office will be working with other advocates and community leaders and working to bring unity around the state around this settlement. We're calling the campaign to achieve maximum relief, fighting addiction, saving lives. We intend to put everything we've got in it to get it done. The other wrinkle, which we cannot control, unfortunately, is that the vast majority of the other states have to sign on to this global settlement. I think we'll get there, but I want to be transparent as possible that there are still some challenges that exist. So that's a lot of information that I've given you here today. I'll be glad to answer any questions, but first I want to reiterate that everything we've done in this case has been focused on our mission of getting justice for victims. Everything that we do from now on in working to achieve the maximum settlement for abatement of the opioid scourge will remain focused on victims. As I've traveled across the state the last 2.5 years talking about this issue, talking to victims, their families, treatment providers, first responders, and the medical community, I've heard many heartbreaking stories of the pain and sorrow and devastation that the opioid epidemic has caused. So today, I'd like to call on a few folks standing behind me to share their personal experiences to help illuminate exactly how brutal this crisis has been and to emphasize how important this settlement is. Patty and Ellis Fitzwalder, thank you for being here, and I invite you to the podium to share your story.
First, I want to thank you, Attorney General, for having us here and asking us to say a few words. The numbers truly are staggering if you think about it. Last year, 93,000 people died from overdose nationally. Most of them were from opioids. Most of those dying from opioid overdose began their addiction with prescription painkillers. Our son took his grandmother's prescription painkillers because they weren't locked up and out of his reach like they should have been. We weren't aware in those years leading up to his death in 2014 that there was an opioid epidemic and that kids were stealing pills from their parents' medicine cabinets. The transition to heroin, now fentanyl, is easy because it's cheaper and easier to get than prescriptions. And you don't have to shoot it up. You can snort it, you can smoke it, you can take a pill. It's that easy. It's put into drugs that are concealed as Oxycontin or Xanax or Percocet. People don't know what they're getting when they buy a drug on the street. Likely they're going to be getting fentanyl that will kill them, and many times the first time. Michael transitioned to heroin, and he died on August 25th, 2014. I can't even begin to express how important this litigation is. We need so many more treatment centers, in-house rehab facilities for people still struggling, and especially for those without insurance. We were lucky we had private insurance for our son, but there are so many that don't. We need to educate our kids by getting into the schools and telling our stories. August 31st is International Overdose Awareness Day. We ask that you display the color purple and remember those we've lost to overdose and pray for those still struggling. To have any kind of a chance of stopping this epidemic, we must end the stigma attached to drug addiction or substance use disorder. This is a disease that does not discriminate and can happen to anyone. After our son passed, my husband and I formed Heal Stop Heroin so that we could let others know what we didn't know. Yeah, that's it. Thank you.
Thank you. And that's not the first time I've heard your story, but I'm moved by it today as I have the first time I heard it. Next, Kathy Arbini, as I mentioned at the beginning, is the mother of Kevin, who died as a result of opioids. Kathy?
Good morning. I'd like to thank you all for inviting me here, just so we can remember all of our children. My Kevin is one of millions of kids that have died. We have Ashers, we have Nates, we have Matthews, we have so many children. I belong to a group called Mo Network, and we have a group of moms. Not all of us have lost our children, but a few of us have, and my goal is to learn as much as I did not know when Kevin was young and using. He started smoking marijuana at the age of 13. I was very ignorant to substance use disorder. I thought all kids wanted to sleep in. I thought all kids wanted to skip school. I thought all kids were moody. And what did I learn? But my son was addicted to drugs. He also started out with some pain meds, Xanax. He was a very depressed kid. So we took him to different places, and wouldn't you know, he was just prescribed more medication, which eventually turned to heroin. When Kevin, he passed away in 2009. In 2007, we found out he was using heroin. My husband, his stepdaddy, wrote a check. We put him on the plane. We looked in the yellow pages. A lot of you are young, you don't even remember the yellow pages, but there was such a thing. And we looked up treatment centers, not very many at all. We did the best we could with what we knew. We thought in 30 days he'd come back and he'd be the same old kid that he was. Well, if I have learned over the years that is not true. It's an illness. It's an everyday thing. I can't imagine going through this every day and wanting to use and can't use. My son had no coping skills. He coped with medication. In 2009, in November 29th, he passed away at a friend's house. The friend was afraid to call 911, so my son laid in someone's basement for 17 hours. And that is so devastating, because I wish they would have called. I wish they would have brought Narcan. But what I've learned is that there is help out there. And if your children need help, you need to get them help. That's the most important. We talk in schools, we talk to teachers. We have to end the stigma of this. There was just so much to offer kids with education, and when Kevin was young, there was none. So I do this in memory of Kevin, but like I said, there's so many other parents that are suffering too. So thank you for having me.
Thank you, Kathy. As you can see, Kathy's been a tireless advocate in getting the word out about the opioid epidemic and ways that we can combat it. One organization that we've worked closely with here in St. Louis is Places for People. The organization was founded in the early 1970s and serves as a shining hope for victims. We have with us today Craig Miner, who is the adult outpatient program manager with Places for People. Craig, would you please share your unique approach?
Good morning. On behalf of the Missourians we serve, my colleagues who provide those services, our leadership team, and our board of directors, we appreciate this opportunity to be here today in support and in unity around this announcement. I'm proud to be part of Places for People as one of the many agencies across our continuum of care that literally day in and day out is saving and changing lives. This opioid epidemic affects all of us. Day in and day out, we have people at our door looking for help. There's such an urgency, and we respond to that urgency. This epidemic was raging long before the pandemic at hand, and so we've been also treating an epidemic inside of a pandemic. So Places for People has been very agile and responsive. And as the Attorney General mentioned, this has no boundaries. Substance use disorders don't discriminate. And so as we're working with people, age, race, socioeconomic status, they all vary. But one of the things is they're coming to us for help, for hope, and we provide that. You know, my journey has been over about 30 years, and one of the favorite parts of my journey is hearing somebody's story, and everybody has a story. And part of that is understanding their relationship with substances. And I will tell you, before this epidemic, I could probably count the number of people I talked to that had overdosed from substances. During this epidemic, it's no longer have you ever, it's how many times and when was the last time. So the urgency is, as people walk through our door, we're immediately providing education and medications that can reverse an overdose. We're really responding to a lot of crisis at that time and really trying to work to stabilize individuals. And through our Center of Excellence, we can continue to provide best and evidence-based practices to train, really literally change the trajectory of people's lives. And there's never been such an urgency. I mean, for me, this has always been part of what I do, but it's just been elevated. And so this just is just astounding to have this opportunity to keep doing what we're doing, but improve on it, build on it. And Places for People is a certified community behavioral health organization. So we're a cornerstone of care in the St. Louis City County region. We provide a continuum of care for individuals that are experiencing low to high severity around mental health and substance use issues. You know, really our specialty is complexity. We're very well known and renowned for our work with individuals where other agencies might not have the tools and resources to support them. And so we do amazing work day in and day out, and want to do that and want to continue to do that. But I'd also be remiss not to note that another thing that Places for People is very attentive to is, while this substance use disorder doesn't discriminate, the disparities. The disparities in access to treatment outcomes, especially for communities of color. And so along with that, the social determinants of health, poverty, we have worked really hard to not only provide education and treatment and recovery, but also those systemic issues that need to be addressed along with it. And so I'm very proud of that piece of the work that we do. And so part of this is allowing us, these types of dollars allow us to, quite honestly, just save more lives, change more lives. The bottom line, we can increase access, we can improve treatment, we can increase recovery, we can do all of these things. It will also help us increase the quantity and quality of our team members. Prescribers are at a shortage. So we're hoping that this will help those things. For me as well, too, I think one of the most important things that's really at our doorstep is increasing our reach. And we've served about 2,500 people last year, about 10% diagnosed with an opioid use disorder. So we're providing these services, but we can extend our reach into communities, North City, North County, and start to address a lot of those issues, and talking about the need for more services. And so I think that's a really big piece of our work, is to be able to expand and be able to provide those things. So, today, again, Places for People stands in partnership with the Missouri Attorney General's office. This will really help forward our mission. Our mission is to improve the physical health and behavioral health of the individuals and families and communities that we serve. So this will forward that. I think and his organization as a treatment provider, as many of me and my colleagues, our leadership team, our board of directors are committed to this. I think we further our commitment, our unity around this. We have been a key partner across our system of care. So I think that our goal is also to continue to be a key partner with everyone here and everyone who is literally saving and changing lives. And it really is about all of us. And we're a part of that, and we're committed to that. So thank you. Thank you for all of your efforts. I appreciate it.
Thank you, Craig. And last but certainly not least, I want to ask Angela Clabon with CareSTL Health to say a few words. This is a community-based healthcare system that provides healthcare to the underserved, the underinsured, and folks who really need the help. So, Angela, would you come up?
Thank you, Attorney General, for having me, and thank you, Reverend Gray, for insisting that I participate. Good morning, everyone. I'm Angela Clabon, CEO of CareSTL Health, as Attorney General mentioned. Our organization, we provide primary care to the uninsured and underinsured in North St. Louis, but we do not have funds to actually take care of patients or provide substance use services. So for me, this is a very, very sensitive topic. As the CEO, I actually decided as a leader that we will provide those services without funds. We have struggled as an organization, but it was extremely, extremely important for me. One of the issues is that, as you all have heard, lack of access. As a person, CEO, and someone who have lost many family members, this year I lost 4. I lost a niece, a nephew, a cousin, and someone dear family, a sister. So they all were to opiates, so this is extremely sensitive. But how I got into it, the community was showing up at our doors, and I could no longer turn them away. To say that we didn't have any services. We have school-based programs, and for some of you all who may not know it, we are actually in some of the largest school systems, and these children are using opiates. and there's nowhere to send these children. And so for us at CareSTL Health, we've decided to create a wellness campus in the Ville community. This wellness campus is designed to have space that's open to the community, to have day programs. We have a MAT program at our health center, but when you send somebody back out in the neighborhood, in the community where it's hard for them not to use, then you end up with more overdoses, and some of them are fatal. So our wellness campus is designed to actually treat the community. One of the questions I asked my team here was, once we get rid of opiates, what's the choice and options for those that are suffering from trauma, pain, all those ills that we talk about? And so for me and our organization, chiropractic services, rehabilitative services, physical therapy, those are the type of services that are needed, and those are the type of services that aren't reimbursed for care by insurance companies. So we really need to have advocacy done to make sure that they reimburse our services. This is huge for us in our community, as I stated. My staff and my board, they have supported me in this initiative to continue to provide these services without funds. So to hear, and I just want to say thank you, that there will be help coming for us, it means a lot. And so I just want to say that on behalf of our community, this is so very important. And for these families who have lost loved ones, we are having an opiate walk August 28th, because the persons that are using, they do not know where to go. For all the persons that you may know that have OD'd from opiates, in our community, they may be diagnosed with ODing from something else. We have lost a lot of persons from substance use disorder, may be diagnosed from chronic disease, but the pain is real. And the awareness, our opiate walk is from 9 to 11. This is our second opiate walk, but it's really to bring information and awareness to our community, because they really don't know where to go and they don't understand the disease. And so this is so important to us. And again, thank you for everyone that's showing up and that have worked so very hard to help us get here. And I do appreciate all the support and the information. Thank you so very much.
Okay, thank you, Angela. Appreciate what you're doing. These are just some of the stories that you've heard here today that make the fabric of the opioid epidemic here in Missouri. These are stories that illustrate the importance of the universal agreement that our state is committed to moving forward on, the importance of getting that agreed to by the other subdivisions. We need justice for these victims, and we need the funds for abatement and treatment right now. So with that, I'd be happy to answer any questions. Yes, ma'am.
So you talked a lot about the universal agreement, the subdivisions, particular segments. How likely do you think that will happen? Like, do you get any sense of how interested other places are in pursuing these lawsuits?
Yeah, we're confident, very hopeful that we will get the subdivisions on board. Obviously, this has been going on now for several years, and there have been conversations. So we're very confident. There's just too much money on the line here for victims, I think, for this not to work out. So we're going to be, as I said, we're going to be working as hard as possible to get those subdivisions on board, and also calling on people in the community to make sure they let those folks know, hey, this is important. We need the help right now, and get on board. Yeah, I personally, as Attorney General, have spoken with several other AGs across the country about this. And I will say this is a very bipartisan effort across the country. And we've had several meaningful conversations with attorneys general across the country. Our teams have been in conversations with those AG offices across the country. So again, I'm confident, hopeful, that we'll get the requisite number of offices on board and move this thing along. Well, we, obviously you heard from a couple folks today. The legislation that was passed a year ago essentially spells out how the money will be spent. Our job was to go get the maximum benefit for victims and their families, and for further treatment and education. What will happen is that money will then go to the state. It has to be spent for education and abatement. So the legislature then will appropriate those dollars to those 4 agencies. And so the organizations across the state will be working with mental health, public safety, and that's how that money will flow to those. So we won't have any direct say over that. Our job is to go out and advocate and get as much money as possible for these life-saving programs. Missouri, we were the 3rd state in the country to file suit back in 2017. So, 3.5 years. And obviously a settlement of this size, it is the largest in the history of the state as it relates to having money actually go to victims. The tobacco settlement, 25 years ago, that money was just dumped into general revenue and then, played itself out over decades. But we're glad that this money is actually going to help real people who are struggling with addiction. And why, the slogan, fighting addiction, saving lives, and really encapsulates what this is all about. We want to save as many lives as possible, which is why we fought so hard. Yes, ma'am. I mean, in a lot of settlements, there's some language like that. Here's what I know, that these pharmaceutical companies operated on the basis of greed and misrepresented to Missourians and people across the country the addictive nature of these drugs. That's what I know. And so whatever, I don't know what they're saying about it, but I'm glad that we're able to advocate as hard as we did for the people of the state, and we can find some relief right now. And so the settlement is with Johnson & Johnson and the 3 big distributors. Of note, it was important to point out, the Endo is not a piece of that. They are one of the defendants in our case, so that still remains. And then we are working on Purdue is in bankruptcy, and we're working to hopefully obtain additional dollars through that resolution as well. Approximately next spring would be the first distribution under the terms of the agreement or the settlement. Yeah. Mm-hmm. Yeah, I mean, the evidence, is pretty damning for the distributors. I mean, they were clearly a part of this scheme to misrepresent what these drugs were meant for. I mean, we've heard stories. We were in Springfield a year and a half ago, and it's not, I mean, you've heard stories here today. A baseball player has an arm issue, goes in and is prescribed 6 months worth of opioids when, a couple days would have been appropriate. And so this was a very elaborate misrepresentation on the part of multiple big corporations, and they deserve to pay, and that's what this was all about. Okay? Yes, sir. Sure.
You have offered to help the District Attorney's Office here in St. Louis with their caseload. They're refusing your assistance. Now, based on recent events with the murder cases being dropped, the prosecutors not showing up at court, being dropped by the judges because the CA's office has abandoned duty. Are you considering filing a quo warranto against your attorney?
I'm not going to get into any of that right now. Our offer to help still remains. I'm committed to making sure the people of this state and the city of St. Louis are protected. And we're continuing to work with federal prosecutors in our Safer Streets initiative, where there's over 600 charges dealing with violent crime. So we're going to continue to do everything we can to protect the people of the state. Sure.
When Jay Nixon was in AG 15 years ago, he actually used that. Is this something that you're considering at least, or you're just watching the ethics proceedings instead?
Of course, we're always watching, and we're monitoring the situation. But my focus is on the people of the city of St. Louis and making sure that they're protected. And we're going to do everything we can to help. Thank you, guys.